Thank you, Chair. Baroness Harding, I was going to ask some questions that would have led to some data and statistics, but given that's not going to be coming, I want to ask, we've seen the disproportionate impact that COVID-19 has had on Black and Asian and East Asian communities. How many or what proportion of the contact tracers that you have are from the BAME community? And why was the app trialled in the Isle of Wight, which is 97.3% white? And what can you learn from how best to communicate with ethnic minorities given that trial?
Let me take that second part of your question first. So the app was trialled in the Isle of Wight because we needed a location that was geographically distinct. So it was the population of the Isle of Wight has been fantastic, and I in no way wish to suggest otherwise, but it was about the physical geography of the island rather than the population. And you are absolutely right that in terms of giving us insight into how you access and inspire the broad variety of communities across the country, clearly the Isle of Wight on its own isn't going to do that. Nonetheless, what the Isle of Wight did teach us is that local community engagement is critical. To answer your first question, I'm actually rather embarrassed to say I haven't got that information, and I will get it for you and send it to you as soon as possible. The way that we have recruited our contact tracers, over 7,500 of them are returning clinicians, so doctors, nurses, dentists, other allied health professionals. I would assume, given the fantastic diversity in our NHS workforce, that a significant proportion of them will be from ethnic minority communities, because the NHS workforce as a whole is very representative of the population. So I would assume that to be the case, but I haven't got the information, so I will get it to you very quickly. That obviously needs validating, but that should be quite easy from the HR systems of our partners, and I will share that. I completely agree with you about the importance of building a service that really does work for everyone. It's one of the reasons why we have launched why the government announced 10 days ago the additional funding to help local governments build their local test, trace and contain plans. Because the way I think we will stamp out COVID in local communities is actually through local communities working together. And so it's important that we're providing that funding, but also that we don't think we're building a system that is entirely national. Actually, this is as much about local action and engagement and as a human as it is about national and technology. And we all need to play our part in the system.
Thank you, Baroness Harding. I think given the fact that you're seeing and we're seeing Black men and women 4 times more likely to die and British Pakistanis being twice as likely to die, I find it a little more than just embarrassing that you don't know how many contact tracers you have from the BAME community. With regards to the local government side of funding, Luton Council was staring at a £49 million black hole when it comes to its finances because of COVID-19. How satisfied are you that local authorities are being given the funding necessary to track, test and trace effectively?
I think it's really important that we are providing that direct funding for the health protection teams in local authorities and in Public Health England. What I'm being encouraged, I'm encouraged by the reaction that we've had from local government across the country, that funding is very welcome. We're expanding the teams locally in those health protection teams. I expect they will continue to expand, and I wouldn't be at all surprised if we need to continue increasing the funding as those teams expand over the course of the next few months. So clearly the overall funding of local government is well beyond my brief. So I can only really tell you about the funding for the COVID containment work in those health protection teams. So I'm afraid I can't comment beyond that.